Hello students, this is Aries, our high fidelity simulator which we have launched in CPS Mumbai just in December 23. Now I would like to tell you about this simulator. He is 25 to 30-year-old, weighing 30 to 40 kg, and the features are, we'll start from the head and now, the eyes and the eyelids. The eyelids will show us the neurological status of the patient, like droopy eyes, and the eyes respond to our sound also. When we go to the right, it looks to the right and vice versa. And the eyelid, the pupils are reacting to light. They show cataract, and the conjunctiva show icterus and bloody eyes like congestion, pallor, etc. And now we go to the nasal and the oral region. In this we can do the airway management and oral management, where we can intubate, we can pass supraglottic airway devices, we can do cricothyrotomy and tracheostomy too. Next we go to the lungs, the heart and the abdomen. In the lungs we can check the air entry on both sides. We can auscultate abnormal breath sounds like rhonchi. We can also detect laryngospasm in this. The areas are demarcated for the heart sounds too. This is the SIM stetho, through which we can auscultate the heart sounds and the respiratory rate. We can detect pneumothorax on this, and needle decompression we can do, which has the marking over here, through which we can do the needle decompression. The heart sounds also can be auscultated, bowel sounds can be auscultated in this simulator, as this is a high fidelity simulator. Now we go to the pulses. We can feel the carotids on both the sides and the femoral on both the sides. We can feel the brachial and the radial pulse only on the right side. Okay, and this is our monitor and this is our workstation. On the monitor, when we attach the pulse ox probe, we get the saturation and the pulse, the heart rate, and BP readings we get when we attach this NIBP. So this is the thing. And IV can be taken. There are points for intramuscular injection. For IM injection we have got point, and IV can be taken on the dorsal aspect of the hand on the left side, and CPR can be given on this patient, which can on this simulator, and it can detect whether our compression is adequate or no, and whether it matches with the ventilation and compression ratio is matching or no, that can be detected. We have got a SIM defib with the paddles, which we can just attach. We can't shock, we can just tell that we are shocking the patient. That is the thing which we can do. Now this is the anesthesia workstation with all the gases, the inhalational agents, which we can recreate the OT setup. As far as possible, it is the OT environment, ideal OT environment, which we can recreate here. And we are having all the emergency crash cart with the intubating endotracheal tube, the ladles, mask and bag, the supraglottic airway device with the nebulizer, and our crash cart is ready. We can also get a 12 lead ECG on a monitor by attaching, see here is the lead which are marked as RA, LA and left lower limb. So after attaching these leads, we can see the ECG finding on the monitor. We can also catheterize the patient, and you are the first batch who gets this chance of working on the simulator, which we have just launched newly. All the best to you all. Thank you.